Hello everyone and welcome to Know Your Drug, powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on omeprazole tablets, exploring the various aspects of omeprazole, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of omeprazole tablets. Omeprazole tablets are primarily used to treat gastroesophageal reflux disease, peptic ulcers, and Zollinger-Ellison syndrome. They are also prescribed for the prevention of upper gastrointestinal bleeding in high-risk patients and for eradication of Helicobacter pylori when used in combination with antibiotics. Next, dosage of omeprazole tablets. The typical dosage of omeprazole for adults ranges from 20 to 40 mg daily, depending on the condition being treated. For GERD, a common starting dose is 20 mg once daily, for up to 4 to 8 weeks. For peptic ulcers, the dosage is usually 20 to 40 mg daily, for 4 to 8 weeks. For Zollinger-Ellison syndrome, the dosage varies significantly and can be much higher, depending on the patient's response. Next, mechanism of action of omeprazole tablets. Omeprazole is a proton pump inhibitor. It works by irreversibly binding to and inhibiting the hydrogen-potassium ATPase enzyme located on the gastric parietal cells. This enzyme is responsible for the final step in the production of gastric acid. By inhibiting this enzyme, omeprazole effectively reduces gastric acid secretion, providing relief from acid-related conditions and allowing healing of ulcers. Next, side effects of omeprazole tablets. Common side effects of omeprazole include headache, nausea, diarrhea, stomach pain, and gas. More serious, but less common side effects include vitamin B12 deficiency, magnesium deficiency, and increased risk of bone fractures with long-term use. Rarely, it can cause severe allergic reactions, liver problems, or Clostridium difficile-associated diarrhea. Next, important advice for using omeprazole tablets. Patients are advised to take omeprazole tablets before meals, preferably in the morning. It is important to swallow the tablets whole, without crushing or chewing them. Long-term use of omeprazole should be monitored by a healthcare provider to avoid potential deficiencies and adverse effects. Patients should inform their doctor of any other medications they are taking, as omeprazole can interact with drugs like warfarin, clopidogrel, and certain antifungals. It's also crucial to follow the prescribed dosage and not to discontinue the medication abruptly without consulting a healthcare provider. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for using omeprazole tablets. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.